welcome. Good morning, everybody. It's Gary Squared back with you today. It's November 10, another dreary day. We're definitely in winter. We've had some good rain lately, which is a good thing, but it's getting chilly out there. And winter may have an influence on COVID too, as our topic of the day, of course. I'm going to start off today with our local epidemiology. My first slide is a snapshot of what Sutter collects. This is the Sutter Bay Medical Foundation. And really whatever color line you look at, it's encouraging. Things are dropping in terms of cases and the percent positives. Next slide, however, is Sonoma County, where there may be something going on in contrast to the other counties in the Bay Area. Sonoma County's got some trends going up. And kind of every trend you look up, our positivity rates going up, our case rates going up, and our hospitalizations are going up. I just came off a call with the county on that. It's a little concerning going into winter, and the weather, of course, is forcing us all indoors more. We're going into the holidays, so we'll be following that, more to come. But the good news is that we're almost 80% vaccinated in Sonoma County, so we've done a good job of doing what we can to prepare for any untoward events in our near future. So hang in there, keep doing your work. Gary, I'm going to turn over to you now because you have a unique situation to present that's something of education for us.
Yeah, so it's always good to know, and I get this question a lot, what's going to happen in the winter, what's going to happen in the next few months. And so far, worldwide, Europe predicts a lot of what we see in the US. And so I'm going to show you a slide for what's happening in Europe right now. And I kind of put some flags on this to kind of tell you where that is. Right now, the UK is having a tough surge. And the UK is the highest country right now in Europe, but many are not behind them. And this just shows that the US, our numbers are going down, but Germany is going up, France is starting to go up. Other countries like Denmark and Croatia, I think Croatia's up 300%. So cases in Europe are going up, and people are asking, why is that? And that's the big question. Now I'll show you to the right of this map, you're gonna see areas in Europe where if it's at all orange or even pink, these are increasing cases, and the ones in the green there are lower cases. So almost every country in Europe is seeing a bump in their numbers. And that's really concerning. It's not because of a new variant, however. And so the next slide I think is really telling. The next slide puts perspective with the US. So to the left, these are the daily cases that I just showed you with Great Britain at the highest. And then if you look to the right on this map, this shows you the deaths of the US versus the Europe. We have such a larger population here that more people are still dying in the US, even despite the surges in Europe. So I think that the surges in Europe really are telling us that we're likely going to see a bump in our cases. And I think we are seeing it in Sonoma County now. And the question is what can we do to kind of mitigate that heading into the new season? And so this is what I think. This is a personal slide of mine. This next slide are what are the factors contributing to this UK surge and the European surge. There is a subvariant of the Delta strain called the AY42 or AY.4.2. However, and this variant's picked up a couple mutations that are very important, both in transmissibility. So it's thought to be about 10%, 50% more contagious than the previous Delta strain. And every strain has already subcategories because the virus continues to mutate. We haven't seen a new strain come out, but the Delta strain has certainly shifted a little bit. It's 12 to 50% more contagious, but it only represents about 2 to 5% of the cases in the UK. So that's not the reason. It contributes to the reason. I think what happened in the UK is early on they were super strict. They vaccinated everyone right off the bat. They were using a different vaccine platform. We were the AstraZeneca vaccine. Then they came behind with the Pfizer vaccine. They clamped down on the economy. They closed businesses. Masks were mandatory. And then and they were super strict and they were super successful. Then the vaccine category came in and that was helpful. Now the UK has become very liberal, where the UK has really relaxed things. So very early on, they sent kids back to school, and they didn't start even vaccinating adolescent kids until late September. That was a big deal. So kids are returning to school and vaccinated. They've dropped their mask mandates. Indoor activities have resumed in the summer. Whether they're indoor or outdoor activities, a lot of crowding has happened. And I think you're seeing the result of all those public health measures. And the Prime Minister, Boris Johnson, is really not connected right now with the public health department there. He's not heeding their warnings. So I'm going to show you a photograph in this slide. This is a crowd that in London that's going to the opening of the movie Dune. And you can see if you look at this crowd, you know, everyone's crowded, everyone's happy, no one's wearing masks.
One mask.
Is he one?
Where's
yeah,
Waldo?
Yeah, one mask. Yeah, where's Waldo on that? So I really think that the UK surge is a factor of many things. Vaccination helps mitigate it. So likely the surge this winter is not going to be like the surge last winter, where we were just trying to roll out vaccine. It's not going to be that thumping, I don't think. But I think we're going to see it, because I think you have to work on all cylinders, right? Vaccination, masking, social distancing, vaccinate kids if that's available. And if you do all those things, I think it works. There's not a single answer that's going to prevent another surge, and I think that's what we're seeing right now.
You know, and as was pointed out on the county call this morning, we're quite a ways away from moving up on the calendar of loosening restrictions and masking. That's not in our near future at all. We're going to continue with masking mandates all through the winter, it sounds like.
Yeah, people ask me, how long do you think we should be wearing masks? And I'm like, we shouldn't stop.
Yeah.
I mean, even after the pandemic, we've seen the flu season improve.
Yeah.
We've seen respiratory viruses improve by wearing masks. I think in the hospital setting, I hope that's the new norm.
Yeah.
Now, this next slide is really interesting. So think about that in perspective. There's a surge in Europe going on right now. They're trying to vaccinate more. They're trying to vaccinate kids, but they're struggling with, do we open up the borders? Do we drop the mask mandate? If you look at this is a vaccination rate in the US compared to other countries. So Europe is better vaccinated than we are, with a smaller population, yet they're seeing a surge. So I think it's going to be inevitable that we're going to see a surge this winter unless the US really steps up with vaccination. And later on, we'll talk about a number of reasons why that dynamic of vaccination rates has a big effect with the pandemic. In Sonoma County, these are our vaccination rates. I really like this slide because still the Delta surge is mainly a surge of unvaccinated people, and that's what's going to happen this winter. It's going to be mainly unvaccinated people, but we're also seeing a number of cases in the very frail elderly. We've actually had a handful of cases in Sonoma County where people who are over 80, over 90 with medical problems have been fully vaccinated and still have not survived COVID illness. And what I'd like to represent here, if you look in the circle shows you the unvaccinated cohort in our county, and it differs by age, of course. Fortunately, the older the age are vaccinated, but as you go down on this, the older the age are also more vulnerable to not responding to vaccine. So I still think we have some work to do. 80% is a good number.
Yeah.
It's not a great number, especially for a much more contagious virus. So I'm hoping that improves as time goes on. So it's a lot of information, sorry to flood you with that.
Yeah.
But I think it puts things in perspective because there are many factors involved with what happens with the pandemic dynamic.
You know, we have kind of hit the wall in the United States at that 2/3, and they've often bandied around this number that a third of the people want to get the vaccine right away, a third of the people soon, a third of the people not going there, and those numbers reflect that. And you know, I was thinking about we're going to be getting into the holidays, meeting with friends and family, and then what brought this to mind is the latest poster child for homemade rationale with Aaron Rodgers, quarterback, high spotlight, is not vaccinated, and he's proposing his reasons, which we have tried to play down for a long time. So maybe it's a good time to go back and give some scientific evidence to counter all the myths that are out there, at least the top myths.
Yeah, I think that's a good idea. Back to the Aaron Rodgers thing, you know, he got his information from Joe Rogan. You know, my son loves Joe Rogan, and I love Joe Rogan on Fear Factor. Joe Rogan's not a scientist.
Yeah.
He's not a medical professional. So some people are still getting their information from podcasts and Facebook. And unfortunately, that's a problem because it's propagating a lot of myths. So let's talk about the 3 big myths that I'm still hearing about from patients as well as staff asking me about this. The one is that vaccines were developed too quick or too safe to be effective, or to be safe. So let's just go back in time. The NIH developed an mRNA vaccine, exactly like the one we have now, in the SARS-CoV-1 epidemic in 2009. So in 2009, we were working on this mRNA vaccine platform. It took 20 months to make that vaccine, but in 20 months, SARS-1 was gone. And so we knew in healthy volunteers it was very safe, and we knew in vitro that you had a good immune response. But we couldn't test it out on an epidemic that had already burned out. We tried to develop that vaccine for MERS, but MERS happened so sporadically in Saudi Arabia that we still can't sort of vaccinate enough of the people to look for efficacy. Then this thing hit in 2019, the SARS-CoV-19 illness, the pandemic started. The NIH removed this 10-year-old vaccine off the shelf, working with this platform and this new vaccine technology, and they swapped out the piece of mRNA from COVID-19, so SARS-CoV-2 for the COVID-1, and now we have this new vaccine. So we've had this technology for more than 10 years. So this is not new, and that's why this is a myth, is that this vaccine was not developed quickly. It's been developed 10 years ago, and it's been effective, it's been safe. And with this vaccine, we were hoping for 50 to 70% effectiveness. 94, 95% effectiveness early on was really a home run. So we got the best of both worlds, an extraordinary vaccine and an extraordinarily safe one. So that's the first myth. Second myth I hear about is the vaccine will insert its virus and alter my genetic DNA. I'm not saying for some people that would be beneficial, but this virus, the mRNA platform, the Pfizer and the Moderna virus, it is a piece of the mRNA, only a very small piece that codes for the spike protein, not all the other hundreds of components of the virus's protein. It's a very small piece. And then what happens is when we give someone an injection of that piece of mRNA, it sits in the part of our cells that is not part of the immune system. So it sits in what's called the cytoplasm, not in the nucleus. Inside the nucleus of our cells, that's where our DNA resides. This virus never gets into the nucleus. It stays in the cytoplasm and just starts making proteins from that viral RNA. And it doesn't make whole virus. The adenovirus platform does the same thing. It doesn't really replicate, never gets into the nucleus, so it never has an opportunity even to insert itself in the DNA. So that's why that's a myth.
Gary, I have a question. So I'm trying to interpret this, but the fact that you did not address the insertion of transmitters, I'm not sure what do you have to say about that? You didn't address it.
That's a good point.
All right.
We're going to go on to number 3. The other myth I hear about is the COVID vaccines are not safe in pregnancy and they can make me sterile. And I actually hear this a lot. We know that in the early vaccine trials, pregnant women were not included, but some women got pregnant in those vaccine trials nonetheless. And we were studied and there were no adverse events. So in early trials, it looked very safe in pregnancy. But we also have this thing called the V-Safe Pregnancy Registry. This is a CDC registry. And so far it's looked at more than 170,000 pregnant women. 170,000 women, many of them are pregnant. Mm-hmm. And in these vaccinated pregnant women, there's been no signal of adverse events, nothing predictable there. And so that's pretty good information. And then on the sterility thing, that's really been studied a lot in vitro as well as in vivo. And I put a couple references here from The Lancet, from JAMA, Scientific American, showing that it does not alter female or male sterility at all. So fertility is not an issue with this platform of vaccines or the adenovirus vaccines. So the Johnson & Johnson, the Moderna, the Pfizer, AstraZeneca vaccines all appear very safe. And doesn't alter fertility as much. So again, that's a big myth that people are trying to understand. But again, these myths get propagated on Facebook. Yeah. They get propagated in podcasts. And unfortunately, that's not peer-reviewed information.
Right. Let's move on to the most timely thing, which was the approval and release of pediatric vaccines. In my next slide, I've got to give a shout out to Brian. Brian Drostowski, one of our own pediatricians, has been the leader in the cause in Sonoma County for all vaccines, and now leading the cause for pediatric vaccines. And trying to get Brian here, unfortunately couldn't make it this morning to talk to y'all. Brian's been out there for the last year at events, raising funds, creating posters, just has really done an excellent job, and he's done a lot of radio spots and so forth. So can't say enough, Brian, about your work. Thank you very much from us and from our entire community. But the vaccine is now available. So I did send out an email just hours ago to all the primary care providers telling you about access to the vaccine. Our own SMGR pediatric vaccine clinic is going to start this Friday. It's going to be very limited in the pediatric clinic itself, just a couple afternoons a week. It might be able to expand if we can ensure more staffing. So the bulk of the vaccinations are going to occur in the community, as they have been with all the vaccines of late. The big pharmacies, CVS, Rite Aid, Walgreens, are doing pediatric vaccines. And then in the email I sent you, there's a link to the Sonoma County Office of Education. And virtually every school is having, if not one, several clinics over the next several weeks. And the calendar is all there. So that's there for you to share with your patients if you need to. Of course, we've shared this with ICT, so hopefully questions about how to get a vaccine will not get to you at all.
You know, Gary, shout out to Brian, because he actually has a video at the Sonoma County website for pediatric vaccination. And I think that's a really good representation for his work as an ambassador. And so he talks a little bit in good lay terms about why it's important for parents to think about vaccinating their kids.
And see if you can find the videos on YouTube where he's singing his creative songs with his son. All right. Last thing I just want to finish with, so in the end of the day, why do we get vaccinated? This is my last slide. Obviously, you do it to protect yourself. You do this to protect those around you that have done all they can. And last time we were here, we talked about Colin Powell, fully vaccinated, had some comorbidities, and unfortunately succumbed to COVID, obviously because he got it from somebody around him. And then the last thing we point out is that it's important to slow the evolution of mutations. And Gary, can you comment on this? Because I was surprised by this fact.
So what's really interesting about about this virus is that it's more conserved than the flu virus. So the flu virus mutates more. Okay. So COVID doesn't mutate as much as influenza viruses, but still this virus picks up 2 significant clinical mutations every month.
That's a lot.
So every variant, it continues to evolve, and they pick up mutations every month. And the question is, are those mutations enough for the virus to change its transmissibility or change its severity and its pathogenicity? I think something is very different with the Delta strain today than it was a year ago. Because a year ago, people in the hospital either got better or they didn't. But when they got better, they went home on room air. Now, 30, 40, 50-year-olds can't get off high-flow oxygen, and they're going to long-term care facilities. So something has changed with the virus because it's had time to evolve and had time to mutate. So the more virus that's transmitted in populations, vaccinated and unvaccinated, the more you add an opportunity for the virus to continue to mutate. So the better we lock down the virus with social distancing and with vaccination rates, is going to lower the amount of virus that is mutating and replicating and mutating and replicating. Because eventually something's going to get beyond the vaccine or beyond one of our therapies. We have 2 antiviral therapies on the cusp of being released in the US, one from Pfizer, one from Merck. If the virus continues to replicate like influenza virus, those antivirals become resistant. And so there's a lot of reasons to follow all those measures. You have to fire on all 6 cylinders in order for the virus to really, the pandemic to really improve.
So like we end every video, the cure is vaccinations. Really get out there and vaccinate your community, keep up your safe work. So Gary, I wonder if people are getting sick of hearing us. We've been singing the same tune now for a long time. Get vaccinated, wash your hands, wear your mask.
Yeah, I wonder the same thing. Sometimes rock stars at a big concert will turn around because they don't know if they're going to see their fans again, and they'll take a picture. Today, what I'd like to do is I'd like to maybe take a picture of everyone out there.
Let's take a picture of our fans.
So for all of you who have been with us during this whole time, we want to celebrate that and take a picture of how you're doing.
Give me a smile.
Yeah, there you go. Hi, Sean.